My name is Aleem Kanji. I'm an endocrinologist and founder of Ethos Endocrinology. I grew up in Houston and Sugar Land. I went to Houston Baptist University, where I majored in biology and business. Then I went to West Texas, where I attended medical school at Texas Tech University Health Sciences Center, spending time in Lubbock and Amarillo. I wanted to come back home, so I came back to Houston, where I completed my internal medicine residency and endocrinology fellowship at Baylor College of Medicine and the Texas Medical Center. The science of hormones and the glands that produce them is interesting and complex. I like the science and the challenge. More practically, I like that I can improve a person's life by either fixing a problem of too much hormone, or when there's too little, by replacing it. But what I like the most is endocrinology is a specialty where you can develop a patient-doctor relationship that grows over time, and that trust and support is very powerful in changing a person's health. At the end of my endocrinology fellowship, I had a decision to make. One choice was to start a position in an insurance-based system, a system where it takes weeks to get an appointment. The patient is sitting in the waiting room for a while. I would get only 10 to 15 minutes per patient for 20 to 30 patients a day. That's not enough time to connect. The second choice was for me to create a practice for my patients. And I realized that creating a practice would let me give my patients the time and care they need. And that's why I created Ethos Endocrinology. Ethos Endocrinology is a direct care practice. Rather than sending a bill to a patient's health insurance plan, we directly contract with our patients. Our pricing is reasonable and transparent. There are no surprise bills, there's no copay. And by removing the interference of insurance from the patient-doctor relationship, we can offer appointments within one day. There's minimal to zero time in the waiting room. Appointments last 30 to 60 minutes, and patients can access me between appointments, so we can make the adjustments that they need. Do you agree that patients need time and care from their doctor for an affordable price? Do you also agree that your doctor needs time with you rather than being forced to do paperwork by a health insurance company? If yes, then Ethos Endocrinology is for you.